AAPC CRC Test 1 latest update. Already passed. Which of the following medications are prescribed to cancer patients to eradicate the cancer or for prophylaxis? I. Tamoxifen. 2. Anastrozole. 3. Januvia. 4. Crestor. A. 1 and 2. B. I and 3. C. 2 and 3. D. 1, 2, 3, and 4. A. 1 and 2. The definition of a best medical record for a RADV audit is A. Documentation validates the CMS requested HCCs, contains all the necessary documentation, elements, and has an additional HCC not requested by CMS. B. Documentation that validates all the requested HCCs. C. Documentation that validates the requested HCC, but there is no provider signature. D. Documentation that validates the requested HCC plus validates an additional HCC contains all the necessary documentation elements, but is missing the provider's signature. For WHA, signed CMS attestation was provided but not signed by the provider. 1/3. A. Documentation validates the CMS requested HCCs, contains all the necessary documentation, elements, and has an additional HCC not requested by CMS. Which of the following are reported by a provider for beneficiaries in a Medicare Advantage plan? I. Nature of the presenting problem. 2. Resolve conditions that have been treated in the past. 3. Family history for all conditions. 4. All chronic conditions. C. I and 4. Which of the following records would be a good source for a retrospective chart audit? A. DME documentation. B. Cardiologist records. C. Dietitian notes. D. RN notes. B. Cardiologist records. Retrospective audits should include the following attributes. I. Provider signatures. 2. Supporting documentation of the patient's diagnoses. 3. DOS. D. 1, 2, and 3. 2/3. Which type of audit evaluates appropriate risk scores of patients? A. ZPIC. B. RADV. C. RAC. D. CERT. B. RADV. What information is required when submitting documentation to support a diagnosis for A. RADV/EVA? A. All patient records for the calendar year resulting in care for a chronic condition. B. All inpatient hospital records where a readmission occurred. C. A single DOS for outpatient records and the full inpatient set for hospital records. D. All professional provider documentation for the previous year. C. A single DOS for outpatient records and the full inpatient set for hospital records. What is true regarding the code assignment requirement for chronic kidney disease requiring dialysis in 18.6? A. The diagnosis should only be reported when the patient is admitted to the hospital. B. The diagnosis should only be reported when the patient is diagnosed with CKD and is actively being treated by a specialist. C. The patient should be diagnosed with CKD and is on chronic dialysis or receiving kidney transplants are associated with this diagnosis. Powered by TCPDF, www.tcpdf.org. 3/3.